Every day, another mother, sister, daughter, friend receives a diagnosis that is breast cancer. This is a life-changing diagnosis, not just for the patient, but for their families, relatives, and friends. But there is hope. Globally, our understanding of breast cancer continues to evolve. Rapid advances in research and technology have improved the access and availability of much-needed screening modalities and treatment options for women across the globe. On this episode of Caribbean Medical TV, we will hear from our experts about proactive steps that we can take to reduce the social and health impact of this condition. We will also understand ways that we can all support our loved ones.
When we last did this program 9 years ago on Caribbean Medical, a lot has evolved in medical technologies, especially with regard to the world of breast cancer diagnosis and treatment. There's been a huge amount of advances. I would easily say that breast cancer treatment and diagnosis is a minimum of 5 to 10 years ahead of many other types of cancer detection technologies and treatments.
You know, I encourage all women, young women especially, be proactive with your health. Take front before front takes you. You know, now we have everything available, doctors, physicians, scientists. We're very pro-screening now. You know, use the technology that's available, especially in people with a family history, and know your risk and know what's available to you in terms of treatment.
We see a lot of ductal infiltrating breast cancer in women, right? These are the ones that they basically develop in the ducts of the breast, and they later would break through the angiolymphatic system. So they go into the part of the blood and the lymphatic system, and once they're not detected early, they spread. So once again, promotion, prevention, these are areas that we need to strengthen on so that we can even get early detection, and then we can work from there.
I know a lot of women have pain in their breast, and when they feel pain, they get scared and think it's cancer. 95+% of patients with breast cancer have no pain. So pain in the breast by itself alone is not a reliable indicator or sign or symptom associated with breast cancer. It's commonly associated with other issues in the breast.
You'd be surprised how many times poor bra fitting can cause breast pain. And so I often advise patients, go and have a look at that, especially where you may have metal inserts and so on. They tend to cause serious discomfort that can cause worry amongst patients. We see a lot of patients with itching and skin conditions. Now, there are very rare forms of breast cancer that can cause problems around the nipple that look like skin itching or skin rashes. But that tends to be very rare and in the very older group, not in the young woman.
I believe in my bush medicine, so I never like going to doctors, right? But one day I just felt like somebody took a pin and just scratched me from here to here. Take the tip of the pin, that's the feeling I got on my breast. And it happened 3 times in a row, consecutively, right? And then I said, that is strange. And I don't know, is the Lord tell me go to the doctor the next day? And when I went and he started examining me, he said, well, he's feeling something. Maybe we should check it out.
Was it a lump?
It was not a lump. It was more like a firm, flat, a hardness. It was not a wrong lump, as most people might expect. So I think, but when they did all the different tests and the biopsy, it showed that it was cancer. I denied it because we were living a very healthy lifestyle at that time, watching what we eat, no oil, veggies, walking. So how could I get this thing? It was unexplainable.
One of the things about breast cancer is that it can be very painless. It often is a condition that you may not know, someone will not know until that problem has grown into a significant size. It's very different from when you have a heart attack You know very there now and then something's wrong about you and you have to go and get it checked out, but not breast cancer. So it's silent, and that's not a good thing. The barrier to screening can often be because of that it is a painless condition that nobody knows about. So screening comes in very useful, but it is to motivate people to be able to go and do testing when you don't feel like you have a problem. That's the key.
Early detection involves doing screening tests. What is a screening test? A screening test means that you are doing an investigation on somebody who has no symptoms or signs of the disease. So for breast cancer, we are fortunate in that we have two reliable screening tools. We have mammograms and combined with an ultrasound.
We know that 1 in 8 women will get breast cancer. Okay, that is established. That's the risk factor. And if you have the BRCA gene, your risk goes up even more. Okay? For us black women, when we get breast cancer, it tends to be very aggressive again. So again, we advise or advocate that you start doing your mammograms at the age of 40. Some radiologists would actually say for the black woman, you should start doing it at 35.
So do you know that the BRCA genes or the BRCA genes are genes that help repair damaged DNA? So they are indeed protective. So we all have the BRCA genes. If BRCA genes are mutated or damaged, they won't function properly, and therefore cell division and changes are more likely to occur. These changes could then lead to cancer.
So if you take mammography, for example, it performs very well in detecting many types of breast cancer. But there are breast cancers that are invisible on the mammogram. Where it is particularly good or strong as a technology is that it's very good at picking up pre-cancer. So this is at a level called stage 0, where it's not cancers yet, but if you left it, it would be. Now, when you look at an ultrasound, which has benefits in terms of patient compliance and patient comfort and so on, it has its weak points and its strong points. It is good at backing up some of the findings of the mammogram, but it also has weaknesses. It is not good at picking up pre-cancer. So it can't stand on its own. And there are cancers that, again, are visible on the mammogram but not on the ultrasound, and vice versa. So ultrasound and mammography combined with examination tends to be the best package of care to give you the safety net to know you're good and well.
I have cases of people who have had a normal mammogram, or mammogram that didn't show anything, and when you did the ultrasound, you found something. There are even patients who have a breast lump. When you do a mammogram, it doesn't really show anything, or it looks benign. But when you do your ultrasound, the ultrasound suggests, well, look, this doesn't look right. And then what you do then now is you get a biopsy.
If we're talking a bit about what a lump could be, so a lump does not only have to be breast cancer. It, as you mentioned, it can be a cyst, which is a hormonal change in the body. And unlike other body parts, where, for example, in the brain, a cyst is a serious condition, or in the pancreas, a cyst is a very serious condition. In the breast, it's a very innocent condition. The commonest thing that people would present with a breast cancer is a lump. A lump can be one of many things. It doesn't have to be breast cancer. But what it cannot be is left alone. That we shouldn't do. You shouldn't leave it thinking it will go away. One of the commonest misconceptions in your anxiety or in many women who panic or become very worried is that they think it'll go away. The innocent things don't go away either, so you might as well take a moment and access care and get a quick answer. There are not many things in medicine where if you have a worry, you can get answers so quickly. If you think about many of the other areas that you've been looking at, many times it's a little more of a testing process, a little more of a waiting to get the answer process. Whereas in breast cancer assessment and breast screening, you can get your answers almost at the same visit. So very quickly, you can get reassurance quickly. Yes, when it is a real problem, that takes a little bit of time, but the majority of people who have problems that they're worried about, like pain and even innocent lumps, we can give answers right away. And that forms a large group.
Thank you, Dr. Rampal of Trinidad and Tobago. Here on Caribbean Medical TV, we hope to increase the awareness of the support and resources available in the Caribbean region and beyond for persons with breast cancer.
At Guardian Group, we've seen so many of our customers achieve great things. From key moments when together we've planned for the future to those unforgettable days when you've celebrated the rewards of those great decisions. So, it's no surprise that after 175 years, our optimism is stronger than ever. Because when you've partnered with people to achieve their best lives as long as we have, you tend to see the world a little brighter every day. Guardian Group. Live easy.
Welcome back. Early detection is life-saving. Screening is critical.
My name is Samantha and I'm 31 years old. I'm a breast cancer survivor. I was diagnosed in February 2021. A lot of people ask me, how did you know? How did you figure out that you had breast cancer? Did you get tested? Was it a random screening? Like, how did you know to go to the doctor? And honestly, I was lying down in bed and I was just literally doing a random check. I didn't often check at the time for anything like that. And I happened to feel something that just was odd. And I was like, what is that? Whatever. And I brushed it off. And I think later on that day or the next day, I mentioned it to my mom. And she said, okay, that's nothing you've brought to my attention before. So let's just keep an eye on it, tell me if anything changes or anything. And I think like a week later, I said, Mom, I feel like it's bigger. I don't want to panic over anything, but I think it's bigger and it's starting to hurt a bit, like when I'm in a certain position lying down. So she said, okay. She said, let's just be safe and sorry. She said, let's schedule an appointment for like an ultrasound or something. Let's just, have peace of mind. And we scheduled an ultrasound and I was sent for a biopsy the next day. And I literally it was one thing after the next, literally all within the same week. And it was just back to back. The importance of health insurance was a huge eye-opener for me. I definitely want to touch on that for a little bit and pause there, because you really and truly, you don't know when and if you will need it. And it's not just about having medical insurance for your dental checkups and things like that, but critical insurance. It's really important because I've spoken to and met so many people who didn't have critical insurance and who did, and it makes a huge impact on your overall well-being, inclusive of your mental health.
So the evidence for self-examination is weakening. And the largest, most common cited criticism for that is that it will not perform well in large-breasted women. So in a large-breasted woman, examining yourself to find a small 0.5 centimeter lump is not going to work. Now, if you have very small breasts, it is going to work, but it still will never pick up what is called pre-invasive disease or very, very small disease. So it's subjective, it's variable, and it's problematic against all breast sizes. It can only work better the smaller the breast. But Caribbean women don't have any one size of breast. It's very variable. And so you need a package of care that works for everyone. I am more inclined to encourage women to learn about breast examination, but to rely on their regular care, whether it be a district nurse, a nurse practitioner, a general practitioner, or a specialist center like where I am, to be able to get consistent routine care. That, I believe, is where it comes in to have the best benefit.
Over the last 20 to 30 years in the Western world, the breast cancer deaths have decreased because you have been able to have effective screening programs. There are a lot more drugs now available for use. We have chemotherapy drugs. We now have drugs called immunotherapy drugs, which target specific receptors and specific pathways on your cancer cells. There are a range of these drugs that are now become available. Those can target patients who have more aggressive or a more advanced cancer. What I have seen in my 40 years of medicine is that the age demographic is changing.
It's no doubt here that we see a lot of younger women with breast cancer. So the median age for seeing women with breast cancer, unlike European counterparts and American counterparts, is at least 5 to 6 years younger. It is very much not uncommon to see women in my practice in their 30s and early 40s being diagnosed with breast cancer.
We know a lot more about the genetics of breast cancer and genetics in general. So there are certain genes that are associated with a higher risk of developing breast cancer. BRCA1, BRCA2, there are some others like PALB2 and a couple of others which we know gives increased risk for breast cancer. And we're able to do tests for these things now, especially in younger individuals who you diagnose with breast cancer. The other thing we also assess is once you diagnose the breast cancer, you look to see if there are any hormone receptors on the cancer, or if there's something called HER2, which is a human epidermal growth factor that's on the cancer cells. So we test these for these routinely, and those help to determine treatment and to some extent prognosis. But like I said, we now are able to do DNA analysis of cancer cells to see what genetic abnormality exists within the breast cancer cells. And then you can use targeted treatment for those.
And now this technology is available right here in the Caribbean, in Trinidad and Tobago. This is called next generation sequencing. Next generation sequencing is a form of genetic sequencing that allows us to look at diseases like breast cancer at the most basic cellular level and employ targeted therapy approach to treat patients. So people with a history of breast cancer or other forms of cancer should be offered genetic sequencing actually, because what we can do is we look at the mutation or the damaged DNA that is associated with this particular disease. Cancer is a disease. And then doctors are now able to employ a very targeted therapeutic approach that would help in the treatment of this patient. So almost as if saying the patient now has an advantage in their treatment. It's a personalized approach to medicine.
I think it's important in the world of when someone is diagnosed with a condition that they are scared that their lives would be taken away. Looking to those who've survived and looking to how they've survived breast cancer and got their lives back is very important, because this is an unknown world that has opened up, and people talk about the negative aspects of things, but there are a huge amount of positive aspects of how do you survive and live your life and get your life back. And I like to focus on that because I think that is what is going to be the motivation to move forward with care. Patients have, for breast cancer treatment, patients have a lot of options. We live in a modern world where oncoplastic surgery and saving the breast, which is called breast conservation, has become a whole new subspecialty in itself, where there's a huge variety of options. A woman doesn't have to automatically lose her breast. That's the first thing for us to have that conversation with our women in the Caribbean, that 40 years ago and 30 years ago, there was one operation, but that one operation of removing your breast is not so. And so many women, and many times in breast cancer, even up to stage 2 and early forms of stage 3, you can save the breast. There are what is called oncoplastic operations where you can help save the breast.
So as you see, I'm a lady that like to dress. So when I heard I had breast cancer on the left side, I it immediately impacted on me in terms of my life, how I would look, how it would impact with my husband, my relationship, and stuff like that. So when we went to him, I raised those concerns, and one striking thing remained in my head with his response was, don't worry, when you awake from that surgery, you will have both your breasts. Because he also does the breast reconstructive surgery, right? So when I heard that, I felt so good. And then he said nobody knows how you're going to die. Yes, you have cancer, but that doesn't mean to say you're going to die from cancer. You could be walking down the road, God forbid, and you get knocked down, and what happens? He said too, if you have to get cancer, breast cancer is still the safest one to get because it is external to your body. You could remove that aspect, you could reconstruct.
The message to get out is to not think that this is going to completely take away your life. You don't have to automatically see that this is something where you're going to lose a breast and that you're going to be unable to look at yourself. That is not so. You can now think about many ways of keeping the way you used to live, the person that you used to love. You don't have to be into something that is now unable to face the world. That's a tough journey, but it is a doable journey.
It's so important for us all to understand how breast cancer can affect the women in our lives. We'll hear more from our experts on how to deal with this diagnosis right after this.
Social investment has always been an integral part of the Republic Group's DNA. The Power to Make a Difference program is the primary mechanism through which we achieve this objective.
Republic Bank Guyana Limited has been very involved in our community through our social investment initiative, The Power to Make a Difference. We have partnered with the Ministry of Culture, Youth and Sports to resuscitate and help develop and build the Steel Pan fraternity. Recently, we launched a project with Cider, and at the conclusion of this program, 50 youth will get grants to purchase equipment and tools to commence their program. We would have launched Fight for Fun, where boys and girls at the primary school level are able to develop their cricket skill, and this is done in partnership with Cricket West Indies and is executed by the Guyana Cricket Board.
Male breast cancer accounts for 1% of all breast cancer in the world.
We fundamentally speak of breast cancer in women, but we need to understand that breast cancer can affect both sexes, right? Because the chest wall has tissue, mammary tissue, both in men and women. One of the things to even consider likewise is that in men, although it's uncommon, it's more aggressive. And we can simply look at the anatomy of the breast. Males, we have a tendency to have more muscle on the chest wall as compared to ladies on average. And as a result of that, there is more vasculature, so you have more blood vessels and less fatty tissue. So imagine you have a mass in the breast of the male that easily gets to the muscle. Once it gets there, you understand it enters the systemic circulation. So there's a tendency for it to be more aggressive in men.
So it's a very, very rare entity. Nonetheless, once diagnosed, it forms the same treatment part. Now, how do men become aware of breast cancer? I think they should be. We have to understand that there is no screening for breast cancer in men because men do not have breast. And almost exclusively it presents as a breast lump. So the advice I would say to men, especially in their 40s to 70s, is that is where examination and self-examination is powerful. So it is the opposite of women. Men do not have breasts, and so being able to detect a breast lump is far more accurate.
Do a self-exam. You may feel a lump, or you may feel a thickening or an area that wasn't there before. as part of the examination, you should lift your arms up, put your hands on your hips and press. You can look in a mirror, look to see, has my nipple position changed? Does the skin look different, like an orange peel, right? That's one sign. Do I feel a lump? Do I feel a thickening? You can look for a nipple discharge. Is it clear? Is it white? Is it bloodstained? Right? So bloodstained nipple discharges are usually more serious in nature. You want to look for asymmetry that may develop, thickening, any change in the skin, any change in the position of the nipple, and of course the ultimate, you feel a lump.
While a breast cancer diagnosis can be challenging, it is important to remember it can be overcome. Vigilance and proper treatment can ensure a return to normalcy and a chance to embrace life with confidence. This is why support for patients is so important. If you have someone facing this diagnosis in their lives, they should know that they are not alone.
I would want to say to the women, our Caribbean women, that having breast cancer does not mean that you won't have your life. There is a lot of hope, very successful treatment, and millions of women are every year surviving breast cancer and living full and complete lives.
In times like a medical crisis, you're going to need these supports, and like having friends and family that you know you can count on in time of need, that's really important. So like these are factors that I pay more attention to now that I would have paid attention to before, but I think from a completely different perspective. Having lived it and gone through it, it's also triggering, I'm not gonna lie, to hear when other people are diagnosed with medical issues, particularly cancer, of course. But to hear things, or when people pass away from something that you yourself have experienced, that, of course, it crossed your mind as well, like, what if?
We encourage all women to continue to empower each other and to take the time to prioritize their health and quality of life. This gift of care benefits us all.
Thank you to each and every one of you in the Caribbean region and beyond. We truly do appreciate your support and feedback, and we hope that you're finding the show interesting and informative. I'm Dr. Mariam Abdul Richards, and I look forward to you joining us on another episode of Caribbean Medical TV.